Hi everyone, it's Dr. Sue. I wanted to just add to our previous audio post about nursemaid's elbow. Just to reiterate one more time to summarize, nursemaid's elbow is something that can occur in children generally under the age of 5. We can occasionally see it in children that are a little bit older, but what happens is you have a traction injury. And what I mean by that is you notice that your little one is injured after pulling of the arms, whether you're swinging a little one by the arms, they're kind of holding onto something and letting their body weight kind of fall down onto those arms, and it can be extremely painful for little ones. So we'll often see them at the urgent care, or we'll get a call from our patients at Purely Pediatrics about what just happened. Why is my little one crying and sad and holding their arm like something's broken? So the first thing we do is and I'm going to use the example of having a call from a patient, because oftentimes this is something that will happen, is that a family will call and I can oftentimes talk them through what to do. So first of all, what you want to do is make sure you think about the mechanism of injury and share that with your doctor if you do have to call them, and let them know exactly what happened. If it was a pulling injury and there was something going on that pulled that arm away from the body, the likelihood that that is a nursemaid's elbow in a child under the age of 5 could be very high. You want to make sure there was no fall injury, there was nothing that may point to a fracture at that point. But what I typically do is this. I will tell families first, go ahead and give Motrin. I ask them the mechanism of injury, how their little one got hurt, and then if I think it's a nursemaid's elbow, I will talk them through what I typically do to manage that. It's called a reduction procedure, and what it means is that you actually allow that elbow to go back into place. You put that you deal with that ligament that's bone slightly slid from, and then you can use a maneuver to actually help the parent to put that bone right into place. It sounds worse than it is, but what I typically do is I will even send a picture to families. You can hear a train coming by. I'm actually in Tonawanda. My son's playing at Gratwood Park. Of course there's a train that's going to come by during the time of my video. Well, we're just going to keep going. It's an Amtrak train. But it's not often that I see that, actually. So, but what I typically do is tell families, I will send a picture, or I tell them what I want you to do is put your hand, grab the elbow, gently grab the elbow, and you'll find that your little one may be holding that elbow straight. What you want to do is gently try to bend that elbow up, and with one hand grab that elbow, put your thumb so that thumb is right in the front. So I'm going to show you the picture. Well, I want to do it on myself here. I want to show you where I grab. So I grab right here, and you can put your thumb right here on your child's elbow. And then typically what I have them do is use their other hand to bring the palm to the floor. And palm to the floor means, so you're kind of holding, so if you see where my hand is, palm, and if they have their hand up, what you want to do is they're going to bend that elbow and palm to the floor. And that is a maneuver that you can use to try to feel the clunk, to get that ligament and bone where they should be. Another maneuver you can use is a maneuver that actually brings your palm up. It's a little bit harder to do, so I typically start with what's called the Pronation Reduction procedure. And pronation just means where your palm is down, so palm to the floor. And if they have an issue with it, what I'll do is I'll talk about palm to the sky and then bend up. So you'll actually move that little one's arm into those positions. So either you'll put your hand on their elbow, you try to get palm to the floor, and you try to feel a clunk. You can try it again if you don't feel a clunk, and keep in mind it's going to be a procedure that's going to be uncomfortable for your child, but only for a second. If you don't feel the clunk, then what I typically do is tell them to go in and be seen. I don't want families to feel that they are on their own with this. If it doesn't reduce, and sometimes that can be the case, it can be, depending on mechanism of injury, it can be a sprain, it could be a fracture. So if you are uncomfortable, and myself or another doctor is trying to talk you through how to do the procedure, and you're just not comfortable, it's okay. You can just say, I'd like to get seen. Remember, the pediatric urgent care is open 10 to 10 every day. At all the locations in Western New York. The Rochester location is open from 2 to 10 on the weekdays, and then 10 to 10 on the weekends. The interesting thing is, after you actually are able to put that nursemaid's elbow back in place with the reduction procedure, it may take some time for your little one to gain confidence again in using that arm. So what I typically do is tell families, give it 10 minutes. Encourage them to, whether it's holding a popsicle, encourage them to use that arm. Let them know that it should feel better, and do some massages of that arm. Within a matter of a short period of time, within just a few minutes, they should be using that arm just as normal, pain-free. So nursemaid's elbow can be very scary and very relieving for families once we're able to get that elbow reduced, if in fact that's what it is. If it does not reduce, what I typically do is I will do an x-ray, make sure that there's nothing that I'm missing. Sometimes if we leave a nursemaid's elbow too long, then that causes more swelling and it's not able to be reduced easily. So don't be afraid. Reach out to your pediatrician, reach out to your docs when you feel that your child just all of a sudden starts screaming, holding their elbow, holding their wrist, and allow us to help you with that. So that's nursemaid's elbow. So make sure that with kids under the age of 5, especially if they've already had a nursemaid's elbow, remember they can recur. They are generally only in one arm. Usually, it's not usually both arms. Sometimes it can be, but rarely have I seen that. Usually it's just the one arm. So try to limit the traction kind of mechanisms, the pulling. Try not to hold your little ones by the wrist and swing. Try to, if you're walking with them and they're much shorter than you, try not to pull too hard on that arm, and allow them to have a little bit of slack. And by the age of 5, that should be something you don't really see anymore. It's very common. And the great thing is they grow out of it. I hope this is helpful, you guys. Have a great rest of the week, and I will be back for next week's discussions.